Welcome to Midlife Moves, where we're figuring out this whole midlife thing one day, one workout, and one what the hell just happened moment at a time. I'm Heather, and if you're navigating career shifts, fitness goals, parenting teenagers, or just wondering when the hell we became the grown-ups, you're in the right place. Let's talk about the real stuff, no filters, just honest conversations and a little bit of chaos. Let's get into it. Hi. I'm Heather Francis, and welcome to another episode of Midlife Moves. Something that I've been thinking a lot about lately is how little most of us were actually taught about our health as adult women. Not just the big things, but the basics too. Like what labs we should be focusing on, the screenings we should be asking for, what stress really looks like in the body, and how to know when something we're experiencing is normal versus something we should actually pay attention to. We do our best. We are the WebMD generation, right? We try to piece it all together from Google. We get a lot of information from influencers. And, we have our annual physicals where we have a couple questions that pertain to things that we have going on, like in that moment. And otherwise, whatever information they want to give us. So it's no wonder a lot of us are really confused about what's going on with our bodies at this point. On today's episode, you're going to hear from Dr. Julie Militello. She is a concierge physician who has a grounded human way of breaking all of this down. We talk about the essentials, the questions to ask at your annual physical, the often missed signs of chronic stress, and some of the health basics that we all deserve to know in midlife. Like what is cortisol? And is it really as big a deal as you hear on Instagram? This conversation felt clarifying. It was very reassuring. And she has a way of talking and making you feel empowered about your health. I hope that you enjoy listening to my conversation with her. As always, I love talking to her. You're actually going to hear from her again. I really enjoyed Dr. Julie. So without further ado, let's get into it.
Motherhood is complex. One minute you're soaking up the sweetest, most heart-melting moments with your kids, and the next, you're hiding in the pantry with a fistful of chocolate, wondering if you're the only one making it all up as you go. Spoiler, we all are. I'm Scotty, a mom of 3, life coach and intuitive, who finally said, screw it. I'm done trying to do motherhood the quote right way, and I started trusting my mom tuition instead. Because the right way is whatever works for you. Momplex is where we cut through the noise, ditch the guilt, and figure out how to actually enjoy being a mom without losing ourselves in the process. I'm not here to tell you how to parent. I'm here to help you stop overthinking, stop comparing, and stop feeling like you're failing because you're actually doing so much better than you think. This is a real, unfiltered, explicit as hell mom talk that you will not get in the carpool line. So let's do this. Real convos, lots of laughs, and a whole lot of truth bombs. Welcome to Momplex. P.S. This podcast is explicit. So unless you want your kids casually dropping F-bombs at preschool, grab your earbuds, mama.
Hi, I'm Marianne Weisenthal, host of the LifeSpeak podcast, a show where we dive into real conversations about mental health, resilience, and navigating life's everyday challenges. Each episode, I sit down with leading experts in health, work, and wellness to unpack big topics like burnout, parenting, leadership, anxiety, and personal growth. My guests share their own stories of struggle and resilience, and together we keep it honest, relatable, and practical. Whether you're looking for fresh perspectives or just a moment to feel seen and supported, you'll find it on the LifeSpeak podcast.
Hey listeners, it's Heather here with a quick message before we get into the rest of the episode. I have been blown away by the level of support from you guys. I love seeing how much the topics resonate with all of you and hearing how the episodes make you feel seen. I genuinely appreciate the outpouring of support from everyone. If you've been enjoying the show, there are a few ways you can continue to support the podcast and the team behind it. If you aren't already, follow us on Instagram at the Midlife Moves Podcast. For more behind-the-scenes info on the show and our guests, check out our website, midlifemoves.co. Reviews go a long way. I'd really appreciate a rating and a review on the podcast platform of your choice. And finally, check out the merch store. It's a fantastic way to rep the podcast and help support the team that makes these episodes possible. We've got some great designs for t-shirts and totes available there. Thank you all again so much, and enjoy the rest of the episode. I am here today with Dr. Julie Militello. Thank you for joining. Technically, thank you for joining me again.
You're so welcome.
I'm
so excited to be here again.
I'm going to be flawless this time.
This is going to be great. It's going to be great. I'm excited.
Can you tell the listeners a little bit about yourself?
Sure. Hi, everyone. I am a concierge physician, internal medicine in Baltimore, Maryland. My focus is really on women's wellness, and that is really my passion and something I like to talk about.
So Dr. Julie and I connected on Instagram, as with slid into my DMs.
Yeah.
And,
I did.
We talked a little bit about like that connection video, and like relationships in like in midlife and what that looks like. And we're not going to get into that a whole lot today, but we are going to talk about, we're going to go back to the basics. Like we're going to get like right back to the basics. The first question I'm going to ask you is, you said you're a concierge doctor.
Yeah.
Can you explain what that means?
So what I really love about medicine is my connection with my patients. And when I was working in the traditional model, and what I mean by that is I was taking insurance, taking a copay, seeing patients every 15, 20 minutes, I really wasn't feeling I was getting that connection. So I explored this concierge model. And what it means is patients pay a yearly fee to be part of my panel. I don't submit to their insurance or take copays. My model is maybe a little different than a traditional concierge doctor, but my patient panel is really small. I guess you can call it like a boutique medicine practice, maybe about 50 patients. My patients have my cell phone number. They can call me, text me anytime. How it works is I usually meet the patient first, see if it's a good fit for both of us, and we go from there. And it really allows me to sit, get to know my patients, and take my time. So that's a little bit how the model works.
Well, it's interesting because like my doctor, one of my old doctor was transitioning to that model.
Yeah. It's happening more and more.
Oh, yeah.
Yeah. I mean, I think both the patient and the doctors are just becoming so disenfranchised with what insurance is doing to that relationship that we're just trying to take it out completely.
Well, I mean, you really don't have this is probably a conversation for another time, but you have lose all control.
You lost self-control. They dictate literally how much time you see with a patient, what you're talking about, what you can and cannot talk. I mean, it wasn't a beneficial relationship, in my opinion. So when I got to explore this and I realized it's not lost on me that it's a privilege to be able to practice this way, it just brought the love back for, what medicine is and what it should be. I get to do house calls, and I really get to know my patient panel, my patients so well. And it's really amazing. You would think like, oh, don't these patients call you at all hours of the night? No, my patients are super respectful. And if there's an emergency, I encourage them to call me. But it's not that. It's really, I really love being a doctor again. It really, working for the hospital system sucked the joy out of it. And I finally am back to where I love being a doctor again.
Awesome.
And it gives me more freedom. I get to do what, and my patients like that too.
Well, sure. Yeah.
They like it. So it's a really great relationship if that's something you can do.
Yeah. I mean, and it gives you access. I have to imagine, I'm making an assumption now. It gives you access to things that like a traditional like doctor that takes insurance would have access to, right? Like I assume there's treatments that wouldn't be covered by insurance that you now like are able to offer for different scenarios, right?
Yeah. And if patients want to do that, they can absolutely explore that. We are able to color outside the lines a little bit, and it's really fun again.
Yeah. That's awesome. That's awesome.
Yeah. Thank you.
Okay. Now, my first real interview question.
Go for it.
We go for our annual physical. We should be going for our annual physical, right? What are the things that we as women should be asking at those physicals, but we're not?
That's a great question. So how I want to start this is by make sure that you're in an environment or a space or an office or have a provider where you feel comfortable speaking up and saying, hey, these are things I want to explore and talk about. Because if you don't have that relationship with your doctor, that's not going to set a good tone for your exam. There's a few things. So when a woman, let's say over 40, is entering her doctor's office, there's a few things that she should be thinking about. One of which is cancer screenings. Am I getting the appropriate cancer screening? Colon cancer screening has been reduced to 45. Am I doing my mammograms? Do I have any risk factors for any other cancers in my family? These are conversations you need to be having with your doctor. Physical examinations obviously should be thorough. And then with labs, there's a few labs that I really, really, really want other practitioners to start focusing on, in addition to just the regular CBC, which is going to be your white count, your hemoglobin, and your hematocrit, or a regular CMP, which is called a complete metabolic panel. It's just your kidney function, your liver function, and the calcium level. I want patients to start asking, what is not only my hemoglobin A1C, but what is my insulin level? And that's a really good predictor of where your sugar levels can be going in the future. What are my inflammatory markers? I like to do something called a cardiac CRP. Then we look to see what are my inflammatory markers, especially those that are connected to the cardiovascular system. What's my ESR? That's another inflammatory marker. In addition to just your regular thyroid panel, should you be asking, do I need additional labs? Do I need something called a reverse T3? Do I need anything more than that? A big ticket item right now in healthcare is, should I be getting my hormone levels checked? That's really variable for where you are in your life cycle. Do I suggest a menstruating 40-something-year-old to be getting her hormone levels checked? The answer is no. I mean, to randomly check your hormones is really not a good idea for a few different reasons. So making sure you have some of those levels in your back pocket will be very, very helpful to you, especially those inflammatory markers and your insulin levels, in addition to the regular things. Another lab I like to do is fractionate your lipids. And what I mean by that is, like, when you get your panel, it's like an HDL, LDL. You want to fractionate those lipids. How much of that LDL is small and sticky and harmful? Or how much of that LDL is actually light and fluffy and large? So that's something else you can be asking your doctor for. And if they bill it correctly, I'm very lucky that I billed correctly. My patients aren't getting stuck with a huge bill.
Mm-hmm. Mm-hmm. So the labs, we just have like the standard.
Yeah, you have the standard stuff. And
So
there's always going to be that standard stuff, especially when patients are older. For example, if they're on Medicare, there's only certain labs you're allowed to check when you're on Medicare. So
right, that's so tightly regulated.
Yeah, it's so tightly regulated. So those are some of my favorite labs, especially for my older patients.
In addition to the labs, are there any screenings that we should be? I know, like a bone density screening, like you hear that, like these are things that I get the regular, like I get the mammogram, I get whatever labs my doctor orders, and I have to go for a colonoscopy for the first time this year because
it's not really bad. You're gonna honestly, it's not terrible. Everyone talks about how bad the colonoscopy. It's really not bad. You drink something, you're home all day, you're gonna poop your brains out. You're gonna go there, get some anesthesia, have the best sleep of your life, and it's gonna be over.
It'll be great.
It'll be so
great.
great.
What did we say when we first started talking? Everything's great.
Everything's great. And if you start saying it enough, maybe you'll start believing it. Everything's so great. Okay, so that's a great question. You brought up the bone density. So a lot of what I do in women's health is talking about bone health. Mm-hmm. And once you hit 30 years old, your bone making is really outpaced by your bone breakdown. So we're starting to see a decline about 30s when you hit your peak with your bone mass. So the problem is our bone density screenings are not covered till you're 65. What does that mean? You can have 35 years of disease and not know that your bones are thinning. Uh-huh. My advice to people, and I do bone densities in my office, they're very inexpensive, maybe $35. If you don't find it for that little, call me. Right. I'm happy to give it to you. It's a really inexpensive test. It's been around for a really long time. I suggest you get it, pay out of pocket. This is not only for women, this is for men too. Osteoporosis is painless. You don't know that you have it until you fall and you break something. We know that our risk of dying once you get a hip fracture is tremendous that first year, just based on complications alone. So bone density is probably one of my favorites. I give all my concierge patients a bone density when they sign up with me, just to get a baseline. And I don't do it every year. If they're normal, I don't do it every year. And if they're young, I don't even do it every 2 or 3 years. But if they're older and I start seeing that thinning, I'll start doing it every 2 to 3 years. And if they're osteoporosis, I do it every year.
I'm going to ask the stupidest question. What is is it a blood test?
No. So bone density test is a test where you're going to lay down and
Mm-hmm.
it almost, and I don't want to say x-ray because people do get concerned about radiation. There is a tiny bit of radiation involved with it because of the technology and the imaging, but you lay down on a table and there's sort of like a C arm on the table that will measure certain parts of your body, including your
Mm-hmm.
spine and your hip. And sometimes your wrist if we can't get a good image of the leg.
Okay.
It's painless. You don't have to prepare for it. It's very inexpensive. If you're over 40, I would get it. Another test that I really recommend women and men over 40 to get is something called a calcium score. Have you ever heard of that?
No. Mm-mm.
Calcium score is probably one of my favorite tests. It is a CT scan of the heart. And what they'll do is cross-section the vessels of the heart, and they will make sure that there's no calcium buildup in any of those vessels.
Is that something that somebody would do with their primary, or is that like a cardiologist thing? Or, I mean, obviously, like if it's like they have a Dr. Julie.
Yeah, they've done. Your primary really should be suggesting it. I'm not going to promise all insurance carriers are going to carry it. Around here,
Sure.
they're about $125 to get done,
Mm-hmm.
but the information that you get from it is really top notch. So that's another one of my favorites.
Uh-huh. That's a good one. That's really interesting because like that heart health, because you don't know what's going on.
You
A lot
have
of
no
times
idea
until
what's
it's too
going
late.
on until it's too late. So this, I mean, obviously it's not going to be as good as if we do, a catheterization where we actually go in. This is non-invasive. It is a CT scan, but it cross sections each of the vessels.
Mm-hmm.
And it will give you a score 1 to 100 of how much calcium you have built up in there, which I find fascinating.
The other thing about that bone scan, sorry, now thinking back on it, so like my grandmother has osteoporosis. Like she is like 4 foot nothing at this point. Like she is small. And so like, I know that it's a risk factor in my family, so like, we should just be, that just feels like something that we should just be doing.
You should go, honestly, just go and schedule it. Your insurance is not going to cover it for you unless you have some risk factors. And having a grandmother with it is not going to be enough. So if you're someone who went through early menopause, that's a risk factor for osteoporosis because of the estrogen loss, heavy smoking, but outside of that, or a fracture.
Why heavy smoking?
Just because the smoking increases your risk of bone loss.
Oh, is it true? I didn't know that.
Yeah. So if a patient's like a heavy tobacco user, we'll scan them and insurance will occasionally carry it, cover it. But like I said, the test is so inexpensive. Does your mom have osteoporosis?
She has
osteopenia.
Perhaps.
Yeah, that's the stage right before osteoporosis.
Mm-hmm.
Yeah.
Yeah, but she's very proactive about it.
Love that.
Like she does a lot of strength training and like she's super. So
what I tell patients is number one is resistance training. That's what we should be doing to strengthen up those bones. Obviously supplementation, calcium, vitamin D, that's another option. But what people also are learning is that creatine has been shown to increase your bone density.
And how much do you and I love creatine?
I can talk about creatine all day. You know that. I love creatine. I should own stock in it. But creatine is something that I've been really urging my patients to use. And it's so easy to get. It's so tolerable. There's no downside to the creatine. It's one of our most widely used and studied supplements.
So you and I are going to do a separate thing on supplements, and like we're gonna like talk it up. We're gonna get into it. But like, I guess really, really quick, just the top 3 supplements that you want every woman to take. Creatine, obviously,
that's number one.
Yeah.
We want to make sure we're getting enough fiber, even though I would love for patients to get enough fiber through their diet. If they need to supplement, that's fine. Another one of my favorites is magnesium glycinate for women to use at nighttime and men. So magnesium is one of my favorites too. But then there's the B vitamins. There's so many, like I can't just name 3. I really do have a lot of favorites.
I have they're all my favorite.
They're all my favorites. There's so many. And there's so many that we can talk about next time that's even more outside the box.
I'm going to ask a fiber question though. Is it fiber itself, or is it fiber to aid with digestion? Like, is that like, what is the reasoning behind it? So like, if you take like a colace,
okay,
in place, like, is that
So the Colace
Colace
itself
isn't
is just
fiber.
going to,
Like I know
it's
that,
not
but
fiber, right? So it's just going to help you loosen the hardness of any stool that you have and help with passage. But with fiber would do that naturally.
mm-hmm.
So, but yeah, we can talk about fiber too, because that's been a hot ticket item recently, in addition to not getting enough protein lately that we should talk
Protein.
about. Yeah,
Yeah.
protein we can talk about all day too.
Yeah, right. Like
Um,
chicken. When we talk about it, we'll talk about when you have the chicken and egg ick.
oh God, are you having that right now?
I'm heavy in it.
That's
I'm
really
working
hard.
through it, but
That's hard.
yeah,
Are you eating
because it's
any
such a
other source?
it's such a good, easy, lean protein, and I just don't tolerate supplements, the protein
Um,
supplements.
okay.
Mm-hmm.
So you're trying to get it through food.
I'm trying to get it through food.
And is it the cooking of the chicken or just eating the chicken?
It's mostly eggs, honestly. So that leaves breakfast really challenging. So I have chicken for breakfast sometimes.
You know what? I don't mind that. I tell my patients like leftovers, if they have chicken, sweet potato, whatever they want to get, I'm okay with that.
Do you know what we're getting totally off topic. It's 7:00 at night. We've both had a long day, but that's okay. One of my favorite meals is sweet potatoes and ground turkey with like
Right.
balsamic glaze on it. I love that. That's
Eat
like
that in the morning.
maybe I will just eat that in the morning. I have
Eat
that
that
for
in the
lunch a
morning.
lot.
Yeah. I mean, the egg
Like,
itself I love eggs. I have 10 chickens. I love eggs, but the eggs are only getting 6 grams of protein per egg. You get a chicken breast, you're going to get 30 grams.
yeah.
So I would eat that for breakfast.
Okay. Well, now that we're totally off topic.
Okay. Yeah. Where were we?
Where were we? Okay. So all right, it's the questions at your physical. We talked about the screenings, we talked about the panels. Is there anything that we should be thinking about? Maybe even if it's something that, like we as women should just be thinking about, just kind of taking stock in before, like at that, around the time we're going for annual physicals or a PAP or, whatever that may be.
I think there's a few issues with one. I think it's advocacy. I don't think women don't speak up as much as they should during times like that. And the reason for that is we're always taking care of other people. Sometimes we don't even know like how we're feeling. We're not checking in with ourselves, right? We're caring for kids, we're caring for parents, we carry emotional load, we're the default parent. We're not going in there always thinking about ourselves to begin with.
Mm-hmm.
And then having to verbalize, like having to actually speak up for yourself and say, hey, I don't think that's okay. It's another big issue. I'm sure. Did you see that trending video recently of the woman that was in labor?
No.
There was a woman in labor and actively, I mean, you have 4 kids, I have 4 kids, active labor, right? She had those groans. And this woman is just sitting there asking about her insurance carrier or who her primary was. She gave birth 12 minutes later. And it was just like, as women, sometimes we're kind of just gaslit or just kind of like, pushed to the side or have, being able to speak up for yourself is a very difficult time, especially when you're in that position. So that's what I'm trying to push to women is just like, speak up for yourself. Don't be afraid. And if you have someone who's not going to listen to you, find a new provider.
Yeah.
Yeah. That was a really hard video to watch.
Well, it's hard. I think most women listening have been in a position where we've tried to express a concern and have been minimized or told we're wrong.
Yeah.
Or, like I think I don't know one woman that doesn't have a story about a medical provider telling her like, oh, you're just
Anxious.
overreacting or you're not like, or
Yep.
I had just to get like, TMI.
Yeah,
I had
totally.
I had a
love
UTI.
TMI.
I do too.
Me too.
I had a UTI. I was like peeing blood.
Ugh.
And I called my doctor and I was like, I know what this is. I know what this is.
Of course.
I know
every
this
woman knows
pain.
what this is, right?
Every woman knows what this is. And he was like, are you sure you don't have your period? And I was like,
Tell me you're joking.
Oh no, I'm not. I am not.
Is this the doctor who went concierge?
No, he's no. The doctor that went concierge honestly was phenomenal. Like he was like, had I had a need for it, like I would have followed him. I just didn't have,
Yeah. I get that.
need. Yeah. So it was my gyno. I called my gyno and I was like, this is my situation. And he was like, are you sure you're not having your period? I was like, I am 40 years old. I am sure I'm not.
I think I know. I think I know.
The pain would indicate otherwise too. Anyway, but yeah, so like we all have stories like that.
We all do. We all do. So, don't be afraid to speak up. It's your health. No one cares more than you.
No one can, right, right. I think, and one of the things that you and I are going to talk to shortly is stress. But I think a lot of things, like I know with me, I minimize a lot of the things that go on with my body. And I just assume like, I'm stressed out. This is just a stress response. And like, you never really know, like, is something really wrong? Or am I just stressed out again?
Yeah, right. You don't, because we live in this constant state, right? And, we can talk about, I'm ready to talk about stress whenever you are, but, short spurts of that stress is normal. It's protective. It's meant to protect us, right? You're like, there's a bear chasing us. We want to run away. What's happening in our society today is we're living in that constantly. So patients are not only feeling stressed in the sense that I feel anxious, they're more tired. They lose motivation. They are gaining weight. There's so many different, you have muscle manifestations of it. So it's not just this fight or flight. We're living in that constantly.
Well, right. Because then we're like, okay, well, am I stressed out? Do I really have something wrong?
Right.
Is it perimenopause? Is it, like go down the list of things. Am I tired?
Yeah.
Do I just need more sleep? Which with me, the answer is always yes. Like some of us just know, like
always
just
yes.
shitty sleepers.
And that definitely comes with perimenopause, right? Like we can't fall asleep or we can't stay asleep and we're up for so many hours a night. So, I mean, sleep is so, so important. And treating it like a job is what I tell patients. Treat it like your job. Like you need a certain amount of sleep to be functional. And it's so easy to say, and it's so much harder to do. But, don't underestimate the value of sleep.
When we went on our trip and when we came home, just switching time zones. I think I got 18 hours of sleep in 4 days or something like that. God. It was a ridiculous amount of sleep. And I was like breaking down.
Oh, I'm sure.
It got ugly.
I'm sure.
But yeah, that sleep component
is a huge one.
Unfortunately, but it's also one of the most challenging. Like if you have a hard time sleeping, like what do you even do with that?
What do you do? What's the first thing we all do is pick up our phones. It's like the worst
pick up our phones.
It's the worst thing.
I know what'll help me. All of the information in the universe.
Yeah, it's literally in my fingertips with a bright light in my face.
With a bright light, just right here, because
right in my face.
My glasses this on.
Right. It makes total sense. It makes total sense.
Which also lends to stress, because let me tell you,
your cortisol is shooting up, right?
Let's talk about stress.
Let's do it.
Let's talk about what chronic stress looks like in the body and when we should not ignore it.
We should never be ignoring it, but it's hard not to. And women are especially sensitive, right? Because we have estrogen plays a role with cortisol production. And we have our estrogen levels kind of going everywhere, right? Especially in perimenopause. Are they up? Are they down? Then you're in menopause and they're in the toilet. So women are especially sensitive. So we need to pay very close attention because women are also hyperactive in that area of the brain. So we're constantly, I don't want to say constantly, but we're more in that area than, let's say, our male counterparts. And the reason for that is obvious, right? We're trying to juggle life with kids.
Yep.
We're trying to juggle life with work. We have maybe aging parents or whatever the situation is. We have all this emotional stuff going on in our lives. And then it manifests in almost every area of our life. We can't sleep. We have muscle tension. We can have TMJ. We could be gaining weight, especially in the abdominal area. That's a whole other issue that my perimenopausal patients are complaining about. So it really manifests in so many different ways in women. And a lot of times, like you said, we're brushing it under the rug.
Yeah, I do it all the time.
Just not paying attention to it. Protecting your sleep is super important. My kids have a rule, unless there's blood or a fire, please don't come into my room. Because if I want someone woken up, I'm up. I'm up for 2 to 3 hours and my night's ruined.
Yes. Yeah. Mm-hmm.
So, that sleep is really important to me. And it's hard to protect it when you have 4 kids.
Yeah, it's very hard to protect it. Can we start with, you mentioned cortisol, and so I'm trying to think of a way to ask this question without me just sounding like a complete mouth breather. So you hear about so you get on, you as a woman, you cannot get on Instagram and not come across a video about cortisol, protein,
yeah,
or a GLP-1. right?
Yeah.
Like those are like the hot topics for us.
Hot. Yeah.
So cortisol, is it as substantial? Is the problem as substantial as like these
These people
buzzwords
are
that we
shocking.
hear?
So let's kind of break it down a little bit. So what exactly is cortisol, right? So it's
Right.
our body's primary stress hormone, and it's made in the adrenals. So what happens is it's diurnal, and it means that it's highest in the morning. So it wakes us up and immobilizes this energy response, and it slowly declines during the day. And it should be lowest at night, which allows you to sleep. So it's designed to be kind of like this wave, but women are living in this constant spike. So the reason why we make cortisol is very natural. We're supposed to. If we see a threat, if we are noticing some sort of emotional response that we need to react to. And then it naturally occurs if we're under eating, if we're under sleeping, if we're overtraining our bodies and they have the stress response. But it was really meant to be for these really short-term emergencies. It was not meant to be lived in constantly. So when we have these elevated states, even as little as like 5 to 7 minutes, these periodic spurts throughout the day, what does that look like? So we can have anxiety, we can have irritability, we can have memory, we can have focus issues, this brain fog that we see a lot of. You see a lot of increased abdominal fat, higher blood sugars, insulin resistance. We have irregular periods as a result of this. And also you can see a libido decrease, right? We're just not as interested as maybe we were before.
Mm-hmm.
So our body is more interested in surviving than being fertile and reproducing. It could affect your thyroid. Is it affecting your metabolism? Are you cold? Are you tired? There's so many things that it affects that we're constantly hearing those buzzwords for, I want to say good reason. I don't know if we're overhearing it, but it does affect so many parts of our lives.
Well, no, and that's exactly what I was looking for. Right.
Yeah.
Because sometimes you just hear a word so much and you're like, what are you trying to sell me?
Right.
Like that's kind of what it.
Yeah.
Thank you. That's helpful.
You're welcome. I always tell patients like, it is hard to recognize that state, and there have been some ways that you can help regulate it. And if you are somebody who can do that, like the mind body connection with like the slow nasal breathing, or have you ever heard of the physiological sigh?
No, what is that?
Taking that deep breath in and allowing all of the air and the oxygen in your lungs to come out. So like
Yeah.
taking that day and then kind of letting it all out pretty slowly. It's supposed to activate your parasympathetic. So the cortisol level is theoretically supposed to slow down and lower. But sleep is a huge part of that. Getting morning sunlight is also a huge part of that. Having a consistent bedtime. You can't just like make up sleep the next day. Having a consistent bedtime is a huge part. Not too much bright lights before bed, 1 to 2 hours. I love my magnesium at night. And you want to make sure you're moving your body during the day and feeding it enough during the day.
Naps don't count.
So I love a good nap. Who doesn't love a nap? I feel like they're super beneficial, but it's not like you can just make up sleep by taking a 2-hour nap the next day, but go for those naps. I think they're good for you.
So here's my sleep schedule for every.
Let's hear it.
So I go to bed at 8:30.
Oh.
And I typically wake up at 1. And sometimes I'll get back to sleep pretty quick, but then I wake up at 3 and my day starts at 3. Because I'm at the
choice?
gym. By choice. Because I'm at the gym at 4. So I take a nap. So I take a nap I have lunch at 11.
Are you eating in the morning?
So this morning was the first time I ate before a workout in a really long time, and I just had like a protein bar. And honestly, like my workout was better than it's been in months.
I don't love fasting workouts for women, and the fact that it's better is just proof of that. I don't like
definitely
fasted
better.
I don't like fasted workouts, and I don't think you're getting enough sleep at night.
I'm definitely not getting enough sleep at night. I'm definitely not. No, and I know that. But if I could sleep, I would. Like part of it is like I'm up anyway. Even on the days that I'm like I'm not setting an alarm, I'm not going to go. I still wake up. I just have to train myself. That would be just training myself.
I know, but the fact that you're waking up at 1 a.m. every day tells me that you're having some sort of cortisol spike in the middle of the night. That's what's waking you up.
And I assume not looking at my phone
Yeah.
before bed.
It's so hard to, we're all scrolling. I mean,
I can just read like a normal
you could
person.
totally just read. So can I. The fact that you're waking up at 1 a.m. is telling me something. You're not getting enough sleep. And the fact that you're needing a nap every day or most days.
Yeah, because I have lunch at 11, and then after lunch, we'll go for a little walk, and then I'll come back and I'll be like, I just need to close my eyes for a minute because we work out of the house. Let me tell you, the minute is not a minute.
It's not a minute. You need to be working out. I really tell my patients, with food in your system. I don't like
Well, I'm
fasted
definitely
workouts.
going to. Today was great. I had a great workout today.
Yeah. And I really like my
protein bar.
creatine post workout.
I'm going to get the powder too.
Get the powder. I really think you're going to like that better.
Yeah.
And I always tell patients, start with a half dose.
Mm-hmm.
So the recommended dose is 5 grams. So you start with like half a scoop. I'll send you some.
What do you think of pre-workout? I know that we're just like all over the place. What do you think of pre-workout?
I don't love the pre-workouts. It's not something that I recommend.
I don't do it. I drink a cup of coffee.
Same.
And then I go work out.
I really need you to eat before those workouts and post workouts. You need to feed your bodies post workout.
Well, I do. I have my egg or chicken, I typically have a big breakfast afterwards.
Yeah. Just 1 egg, not enough.
No, 2 eggs with cottage cheese and some other kind of like meat.
Right.
Yeah.
Wow. Great.
Yeah.
Love that.
I've been on avocado toast lately too. So anyway,
I was going to say, I do like a carb. I do like a carb post workout.
I like a carb. Honestly, I like a carb too. I really prefer potato.
Yeah. Okay. Or even like a
sourdough.
Post workout, I really do like a carb in there. Put some protein. Yeah. Okay. But we can talk about that. And especially, we should also be talking about how we should be feeding, ourselves. And a lot of us have kids in sports. How we should be feeding our athletes.
So I agree with that. We could go down a rabbit hole. We're going to make a note. We'll come back
talk about all those things. Great. Because that's a huge thing.
Yeah.
Great. Okay, cool.
Yeah. Okay. Back to stress.
Okay. That's where we were.
All right. So I guess let's like talk a little bit more about that sleep component. And then, because it seemed if I had to guess, that's probably an issue for a lot of women.
Oh, for sure.
That's probably one of the bigger issues for a lot of us.
Yeah.
Okay. So we're not looking at our phones when we wake up. Okay. We're taking magnesium glycinate before we go to bed.
Love that. Mm-hmm.
What are what's like 1 or 2 other tools that we can use to either get to sleep or stay asleep?
Okay, so a consistent bedtime like we talked about, but in the mornings, I really like my patients to get some morning sunlight in their eyes. I'm not telling people to look directly into the sun. That's another misconception. You don't need to go blind. Okay, so can we talk about it? Can we just put that out there?
I no longer feel like such a mouth breather from you saying that, because
you
people
don't
really
need to.
think
Who
that.
says you need to look into the sun? That's not how it works. I just want to get some sunlight into the eyes. Indirectly would be fine.
Sure, indirectly.
Yeah, indirectly.
Specify. Yes. Don't look at the sun, ladies.
Yeah, don't look at the phone. That's like one of the worst things we can be doing for ourselves.
Mm-hmm.
Yeah.
Oh God, the sleep.
The sleep is tough. The sleep is tough. If you're waking up every day at the same time, something's wrong.
So
you can check your cortisol level, just so you know. If you are interested in knowing what your level is, there are certain tests out there that you can check. You can check an 8 a.m. cortisol level. I would tell patients to do like no coffee, no caffeine, no stress. Draw the level at 8 and see what it is. There are other tests out there where you would check it, I believe it's 4 times in the day, and then you would send in the sample. But if your body's under stress. I could do the test, but
No, I think that like realistically, like I know when I'm operating under high stress.
Yeah. We're really reactive. We're short. We're tired. We're cranky. We have all the signs.
Yeah.
Yeah.
Yeah. When I start telling my kids, when I start slamming the counter, that's generally the cue. They're
that's a sign for you.
It's her. She's back.
She's here. She's here. She didn't get her nap. She's back.
She did get her. She only closed her eyes today.
For 1 minute.
For 1 minute.
Yeah, it's hard. It's really hard. And especially as we're getting older, so many things are changing, and trying to navigate that is really difficult. I had to schedule a test for my daughter. She hurt her knee, and I had to navigate the system as a patient. And I said to my husband, I was just like, healthcare is so complicated to get anything done in this system. It's so hard. You're waiting months and months. You have to make a million phone calls, press this, press that. Navigating healthcare in general is hard.
Well, because you're in an area like ours, like you're in a highly populated area. You probably have like one or two or maybe three like major health systems to access.
Yeah, we have huge health systems, and the waits are so long.
They're wild. My husband had to get an MRI.
Yeah.
And it was like a 2-month wait for an MRI.
That's crazy. I had to do an MRI, and then my insurance company ended up saying no. So I just had to pay out of pocket. I was like, why do I even have insurance?
Why do I have insurance?
They want you to jump through a million hoops. You need to get an x-ray. I'm like, okay, fine. I'll get the x-ray of her knee. And they're like, okay, well, now you need to do physical therapy. I'm like, you want me to take a 10-year-old to multiple sessions of physical therapy? Are you crazy? Let's know what's wrong first.
Just do the MRI.
Just so I can know.
Yeah.
So that's where we are.
On that note, if you could give every woman in midlife in this like age range one health habit that you would want them to stick with, not a diet or a detox or anything like that, but like one just like simple executable. It's been a long day, ladies. Just bear with us. What would it be?
I want women to know in this point of their life, it's not too late. People always think about, oh my God, in my 20s. Yeah. But you know what? I'm stronger than I am now than I was in my 20s.
We're so young. We have so much life left. Yeah.
The one thing I would tell people is to walk. I don't care how fast, what you're doing, walk. Get outside and walk. Yes, it is exercise. So the people who are the naysayers out there who are saying it's not, they're lying. And be sleep. That would be my two biggest things. Treasure that sleep. But get outside or inside. Yeah. If you can walk, just walk. It's been shown to be so helpful for so many different reasons.
That. I love walking. I love walking for my mental health is like
by walking, by moving your body, right?
Even
outside, inside, it really doesn't matter. You want to throw on a vest, we can talk about weighted vest next time. You want to throw on a vest, great, but just get your body and get walking.
Do you like the weighted vest?
I do.
Do you?
I'm a huge fan.
Are you really?
I'm a huge fan. Not everybody should be wearing it.
Yeah.
There's a population out there who really would benefit from it.
Yeah. That's awesome.
Do you have a weighted vest yet?
I have multiple.
You have multiple. So you like a weighted vest?
I like a weighted vest on days that I'm not doing anything else.
I only tell patients 30 minutes, 3-4 times a week.
Yeah.
10 to 15% of their body weight.
I did a 20-pound weighted vest for a 3-mile walk, and that was a mistake.
That's a huge mistake. I can just tell by looking at you. That is too much for you.
That was a big mistake. I got out like the mile and a half, and I was like,
oh, it was too heavy for you.
Mistakes were made today.
Now I have to walk all the way back. 10 to 15% is all you need.
Can I just leave this on the side of the road?
Yeah, you can.
In hindsight, that was an option.
Whitney Cummings posted that exact scenario. I was following her on Instagram. She's like, hey, I'm walking with my weighted vest. And she rips it off and she says, and if anybody wants to come get it, it's located right here. And she throws it and she kept walking. And I was just like, that was very real.
In hindsight, that's what I should have done. The freaking thing.
My back
hurt so bad.
You can tell just by the vest itself and her body frame. It was just too heavy. You really don't need to be wearing 20 pounds.
I typically do 12.
Yeah, that's great for you.
Yeah, it's perfect.
Yeah.
Okay, Dr. Julie, how can everybody find you?
You can find me on Instagram. It's Dr. Julie Militello. And like I said, I'm in Baltimore. Give me a like, give me a follow.
And I'll have her information in the show notes and we'll shout it out on Instagram. Okay, thank you. Thank you so much for joining me.
Oh my God, you're so welcome. I can't wait for our next one.
I can't wait for our next one. Yeah.
All right, awesome.
All right. Until next time. Bye, guys. That's it for this episode. If you had fun, learned something, or just feel a little less alone in the chaos, make sure to hit subscribe so you don't miss what's next. And if you want to keep the conversation going, come find me on Instagram @HeatherMoves_, because midlife is way more fun when we do it together. Until next time, keep moving forward, or at least keep moving. See ya.